So after surgery, they typically will go for rehabilitation. What are some of the common guidelines? What are things like in terms of the rotator cuff after it's repaired? Do you move those people early, or are they immobilized? Labral tears after you do the surgery, do you move those or you hold them back? What are some of the guidelines that you think of after surgery?
Well, I'm a firm believer that patients who have a surgery need to get into physical therapy right away.
Mm-hmm.
And so I usually have them start physical therapy on the third or the fourth day after the surgery. And in the case of a rotator cuff tear, we're going to treat that person differently than the person who has had a labral tear. You're right. The person who's had a rotator cuff tear responds well to passive range of motion. So we want to make that shoulder move and keep it loose, but we don't want the person to do the movement.
Mm-hmm.
So we have the physical therapist do the stretching while the person lies there or sits there and is stretched. That allows that rotator cuff to heal and to mend.
Mm-hmm.
With the labral tear, it's the opposite. We actually want to start moving that person early so their shoulder doesn't get too stiff.
Mm-hmm.
The rotator cuff is not a problem, so those muscles work.
Great. Once they have the surgery and they go through the rehabilitation, what are the success rates for getting back to their previous function? Will people have rotator cuff tears? Can they get back to playing tennis? Can they throw a ball and things like that?
Yes, they can. They typically, if we can catch the injury early enough, if we can catch it within several months of when it's happened, then the prognosis is very good for those people to have recovery. The person who has a rotator cuff that's been going on the order of years, 3 years, 5 years, 10 years, repairing that cuff, sometimes they'll have a harder time getting back their motion. The success rate is good. The success rate, fortunately, is good with the majority of the shoulder surgeries that we do. Specifically with regards to the labral tears, that success rate is greater than 95%.
And quickly, before we wrap up, just some thoughts of prevention. What can people do to prevent these injuries from developing?
I think the best thing to do is to keep your shoulder muscles strong and toned. I think that icing after you do a repetitive activity, and I think that even taking over-the-counter anti-inflammatories if you have some tenderness is a reasonable thing to do. That plus keeping your shoulder fluid and the motion fluid. I tell my patients if they're starting to get a stiff shoulder, if you're taking a shower when the water is warm and hitting you, stretch out your shoulder, keep it moving, and that's going to help you out in the end.
Great. Thank you, Dr. Torpey. Thanks for joining us.
Thank you, Dave. It was good seeing you.
We appreciate it.
Yes.
We heard today from Dr. Brian Torpey about the different shoulder injuries that can occur in your body. Hopefully you've learned some prevention techniques and things to avoid. Thanks again for joining us on You and Your Health. I'm your host, David Bertone.